Welcome once again to The Sage. Thank you for being with us, and what a journey it has been. For those of you who were with us for the past 2 weeks, we had discussed the issue of Black Africans in the diaspora. We had dwelt a great deal on the UN decade for people of African descent. We had talked to amazing young doctors, women doctors, who reside in Canada and who had shared their own take on the health of young people. Today, I am so pleased to say that I was able to bring one of them back on set again, this time to share more in detail about her work, her life, her career. And why do I think the issue of Black Africans in the diaspora is so important? Let me actually put just a little bit of our Nigerian statistics. A recent World Bank study done last year actually showed that 50% of young Nigerians want to leave the country. Our official statistics show that well over 17 million Nigerians are in the diaspora. Next to oil, one of the greatest sources of revenue for our country, Nigeria, is actually funds transferred by our people in the diaspora to the country. So on many fronts, whether it's in terms of large numbers or in terms of resources or in terms of hopes and aspirations, diaspora existence is of great importance to our young people in the country and to young people everywhere. And so it is with a great deal of pleasure that I introduce my guest for today, Dr. Ifeoma Achebe, welcoming you once again to The Sage, and really thanking you, because you've devoted time from your very hectic schedule and life to spend so much time talking to us on the Sage.
Thank you very much. As always, it's a pleasure to be here today.
I can only do Ifeoma justice. Allow me to call you Ifeoma. I do have that habit of dropping the doctor title after the first, and going on to Ifeoma. But I can only do you justice by telling our viewers a little bit more, really, about you and what you are. And so I will read her bio, because that is the respect that is hers and due to her. Dr. Ifeoma Achebe is a public health and preventive medicine specialist based in Alberta, Canada. She obtained her medical degree in 1996 from the Nnamdi Azikiwe University Teaching Hospital, Nigeria, and proceeded to the London School of Hygiene and Tropical Medicine of University of London, where she obtained the PG diploma in infectious diseases and a master's degree in epidemiology in 2002. She moved to Canada in 2004, where she completed a residency program with the University of Alberta in public health and preventive medicine. She is also a fellow of the American College of Preventive Medicine. Dr. Achebe currently works as the lead medical officer of health in the central zone of the Alberta Health Services, which is the largest employer of labor in the province of Alberta. She also holds a clinical lecturer position at the University of Alberta School of Public Health. She has many interests. She's a mother of 3 beautiful children. She's worked for many years in Canada. She has a lot to share, to inspire many of us. Ifeoma, once again, welcome to The Sage.
Thank you very much. My pleasure.
Let me start by saying to you, was this your life journey? How did it start? Why medicine? And why the paths you chose? And as you're describing it, I'm waiting to hear something. a public admission from you.
All right. Right. Okay. So I would say that my interest in medicine started when I was in high school. I used to do a lot of sports, and I actually got an injury once, and my mom took me to the hospital, and I met a doctor who treated me so well, and then from then on I said, oh, I want to be like him when I grow old. And my parents said, okay, fine, if you want to be like him, then try and do well in your sciences. And so I started putting more efforts there, and luckily for me I was able to get in the SQA, finished my medical school there, and then while there, I met Dr. Ogbuagu, who happens to be my teacher. So that's the confession. And was a lecturer for community medicine in those days, and we admired her a lot. I personally admired her a lot, and wanted to be like her when I grow up. So she actually made me very interested in public health. And I remember one project that we did in Neni. Then I'm not sure if you still remember that, but we went there. It was community diagnosis in Neni, and we went there, did some interviews and surveys of people there, and women and children, and found out what their health needs were, and we reported back to you. So that was really neat for me then. I'm
wow.
Like, what a way to impact a population. And so I started thinking about it. And when I finished, I did my internship at UPTH in Port Harcourt, and got married. Following that, we moved out, and I got this opportunity to do this at the London School. That was my first leg into anything public health related. So I did my postgraduate diploma in infectious disease, which was part of my epidemiology master's program. And so following that, I moved. Of course, I had kids along the way, and came over to Canada. Being a foreign trained physician in Canada, I had to go through a series of exams in order to get into residency. I was still very much interested in my public health. I took the exams, passed them, and then I got into University of Alberta School of Public Health and did my residency there. Finished, and then started work with AHS. I've been with AHS since I finished in 2010.
AHS is
Alberta Health Services. Yes. So I've been there since 2010 when I finished residency, and initially as a medical officer of health, but later on I moved to the lead. So I have a team of physicians and other staff that work for me in that zone. Yeah, so it's been an interesting journey, and
it's been quite a journey.
Yeah, and I don't have any regrets. Getting into this area, it's given me the kind of exposure that I wanted, and at the same time affording me the time to take care of my family. And it's a specialty that it's a specialty where you take care of the entire population. You don't just have one patient. The population is your patient, so to say. And so when we have issues, we come together, we solve it, and we try as much as possible to bring the health of the population up as we move along. And we also assess how well we're doing by looking at our surveillance data, which tells us exactly where.
I'm going to stop you there.
Yeah.
I'm just saying that is absorbing, and I'm going to ask you to describe your normal job a bit more in detail. But before then, let me just acknowledge and say that this is the type of child that gives joy to every mother's heart. And I find I am very, very pleased indeed and flattered to know that what I helped to do with my students panned out so beautifully in somebody like you. I, of course, think you're in the best line of medicine possible, but I'm also very, very proud of what you have become. I'm very proud of the determination and fortitude you have shown, and of course the brilliance in going through all the, scaling all the ladders, and getting there, whether it was the training in Nigeria or the training in the diaspora afterwards and so on, but also doing so well in progressing within the job. And so proud of you as a Nigerian, a young Nigerian in the diaspora, but also proud of you because of my special privilege in having been a little part of that your journey. So Ifeoma, thank you so much for saying those things, and thank you for giving joy to my heart.
You're most welcome.
So tell us, in your position now in the Alberta health system, what is it that you do? What is your,
Okay, so there are 5 divisions in public health. Health protection, which entails things like communicable disease control, so the immunization, COVID work. We also have health promotion, prevention of chronic diseases like high blood pressure, obesity, diabetes. We have surveillance, which is the data, because with public health we can't do without data.
Absolutely.
Data is our bread and butter, right? Mm-hmm. Yeah. And then we have the chronic disease prevention, and surveillance, chronic disease prevention, health promotion, and health protection. Yeah, so those are the 4 areas. So we have programs that we work with under these areas that I've told you about. So we have the CDC, and under that we work under the mandate of the Public Health Act. So we are appointed executive officers.
Okay.
And we have a list of diseases called the notifiable diseases, about 100 of them. And so by law, if the lab gets any of those notifiable diseases, they have to notify us.
Okay.
And what we do in return is to look at the history, exposure history, contact tracing. And
I think COVID made all of us aware
of contact tracing.
Yeah, absolutely.
Yeah. So we've been doing that for ages. We do it for things like TB, chickenpox, measles. Measles is a big one. Even influenza and stuff like that. So we then give them prophylactic treatment so that they don't, go ahead. So the contacts we give prophylactic
so they
treatment,
don't spread the infection.
Exactly. So that's part of what we do. And then we also advise the government. So the surveillance data, we look at it with the experts. Thank goodness I'm also an epidemiologist. So we look at the data and analyze it, and then advise the government on where to put more emphasis. For example, there was a time when we were seeing a lot of overdose deaths from opioids. Yes. So there was epidemic.
It was as bad as
that. So a particular one was fentanyl. And sometimes it's adulterated with other things like benzodiazepams and stuff like that. So that caused a lot of deaths in our young people. And so we saw that it was the surveillance data that pointed us to that in the first place, and then autopsies and their results. And so we knew that there was a problem there. And so the government was notified. And we came together and decided on the measures to take. So we're providing kits, naloxone kits to help bring people out of overdose status. So what we call harm reduction here. So that's one. And then the other things that we do is ensuring that the water and the food and the air we breathe is safe. So we have executive officers that work under us. So they go to the restaurants and make sure that the food is being handled in a proper and safe way.
Okay.
And if there's any foodborne illness, we go out there to investigate. They go out there to investigate.
So you're really controlling the public health department.
Yes.
In my years when I trained in Britain too in public health, in that old-fashioned way, where what we used to call even environmental officers, functioned under the
yes.
That's very interesting.
Yes, we still have them here. Yeah.
So that is good.
Yeah.
That's interesting.
So the environmental or health officers are like our enforcement people, in the communities. So when there's a problem with the water, like there's a water main break, and so if the drinking water is compromised, then we issue a boil water advisory so that they don't use the water for drinking purposes, and then we rectify what the issue is, and then they test the water again and make sure it's safe.
Okay.
Yeah. So those are the kind of things that we do, and then of course travel health. When people travel and bring back things like TB, we get notified and then we trace down to the vessel, the airplane that brought them, to say, oh, you were in that plane and there was a measles case there. So you could be a potential case of measles if you don't have your...
For something as minor as measles?
Yes.
Really? That's
measles is very serious here.
Really?
Yes. So we'll track the people in the same plane, sitting 2 rows in front, back, and then on the side, and let them know that they could have measles, especially if they don't have the vaccination history. Yeah, so those are the kind of things, preventive measures. And then outbreaks too. We manage a lot of outbreaks in homes, nursing homes,
where the people are living together.
Yes, congregate living facilities like the shelters, prisons, So we help them to manage those, and we have guidelines that we use to manage those. And we also have nurses that we work with that help to manage those outbreaks with us.
Sounds like a very absorbing job, eh?
It is. So we when you're on call, you're on call for those kind of things. But when you're not on call, you just do your routine things, so policy things, program planning and stuff like that. Yeah,
that's so absorbing.
It is
for me on several fronts. One is that it sounds like an exciting job, something new. It has the potential of something new every day. But it's also, for me as a public health physician myself, interesting to note that many of those idealistic aspects of public health that we study about, you're actually able to execute under one umbrella, which I cannot spend too many times in the third world, in Nigeria and other countries. It doesn't happen effectively.
Yeah, I think the main reason why it's possible here is because of the kind of healthcare system we have is publicly funded. So everything is under the government. So we're able to work as those eyes of those
and the government is reaching as many people as possible. I mean, that is great. Ifeoma, now we will milk you the most we can, and we're going to take a short break.
Okay.
And when we come back next week, to our viewers, Ifeoma is going to tell us a bit more about how she copes. She's a mother of 3 beautiful children, and she's also going to have a word of advice, of encouragement. She will have suggestions for many of our young people there watching us who may want to get to where Ifeoma has gotten to, whether it's in terms of the diaspora, but also whether within our country, Nigeria, how they can achieve their dreams and their hopes. So stay with us. Ifeoma, thank you.
Thank you.
We shall be back next week to finish this absorbing and amazing discussion. Thank you.